All that looks white on skin might not be vitiligo. There are so many skin conditions that can cause white spots on the skin. Let's see some common conditions that people can mistake for vitiligo. Hello everyone, I'm Dr. Harish Prasad. I've done my MD in dermatology and fellowship in dermatosurgery. I specialize in vitiligo and hair transplantation surgeries. Pityriasis versicolor or tinea versicolor is a common superficial fungal infection. Here the fungus interfere with the normal pigmentation of the skin, resulting in small discolored white patches. These small white patches can combine with each other to form a big patch with surrounding discrete small patches. Pityriasis alba, it's a form of mild eczema which is common in children and adolescents. It occurs most commonly on face. They are round to oval in shape and they have a characteristic feature of fine scales on their surface. The hypopigmentation is more visible in summers. They disappear over time with moisturizers and mild anti-inflammatory medications. Idiopathic guttate hypomelanosis. The most common entity which are mistaken for vitiligo. They're seen over the legs and forearms. They are 2 to 5 millimeters flat white spots. They appear as a part of aging process. They're common in patients over more than 40 years. Treatment is not required as these spots are asymptomatic. But sometimes we can do slight cryo or topical immunomodulators or camouflage. Post-inflammatory hypopigmentation. It's an acquired partial or total loss of skin pigmentation which is seen as a sequel of many inflammatory skin disease like atopic dermatitis, seborrheic dermatitis, psoriasis, discoid lupus erythematosus. It can be also seen post-infections like zoster and impetigo, post-procedures like chemical peels lasers, and post-burns too. They repigment spontaneously. Lichen simplex atropicus. It is a chronic inflammatory dermatosis with anogenital and extragenital involvement. They present as a flat white polygonal papules and slight atrophic white plaques. They are generally asymptomatic, sometimes slight pruritic. They are managed by topical anti-inflammatory agents. Lichen simplex atropicus. It is a chronic inflammatory dermatosis with anogenital and extragenital involvement. They present as a flat white polygonal papules and slight atrophic white plaques. They are generally asymptomatic, sometimes slight pruritic. They are managed by topical anti-inflammatory agents. Nevus anamicus is an area of skin that has limited blood flow compared to the surrounding skin. This leads to a pale area on the skin that appears white. The affected area has blood vessels that are always constricted. It's seen at birth and persists throughout, which are not harmful or problematic and hence no treatment is required. Nevus depigmentosus. It is a birthmark characterized by a well-defined pale patch with an irregular but well-defined borders. It is caused by altered clone of melanocytes or reduced melanocytes or reduced melanin production or by reduced melanin transfer to other cells. It is managed by excimer laser and skin grafting. As we saw, there are so many conditions which can cause white spots on the skin. Diagnosis is the key for vitiligo management. Thank you. Isn't it very relieving to know that all white patches are not vitiligo? Comment below what white patches you are worried about. I'll reply with a possible cure or treatment available at Vitals Clinic.